Hi. Sometime back, Kenza and I did a video of sample responses for interviews, and we received a really welcoming response from you. So today we are back with another round of sample answers and responses, and this information will go that we will go over now is applicable for any applicant preparing for any interview for a DDS interview. So listen up. Right, Kenza and I will tell you guys as to how you can uncover all the elements that your interviewer might ask. And right now, you're at that stage where you've cleared your bench and you've received an invitation to go to the interview. So the school has tested your clinical decision making, and your hands-on skills. Now, what are they looking for in your interview? They're getting to try to understand the full picture of who you are. What makes you you. So, what will an interviewer ask you? Anything that can tell them more about you as a person, a student, as a dentist, and what does this entail exactly? Behavioral based questions to know what's in between the lines, to know the real you. Profile based questions, especially about your clinical experiences, and sometimes ethical scenarios as well, to evaluate your logic when you're faced with a moral dilemma. In this video, we will go through a couple of behavioral questions and profile based questions, especially the kind that will come for your closed file interview, where they go from one question to another and then keep mining information from you, and creates a flow of conversation. So that's what we'll do this time.
How should you tackle profile-based, behavioral-based, and ethical scenarios during your interview? We'll use a dummy profile, and then we'll tell you exactly how to do it. Meet Sarah. Sarah is a 28-year-old dentist from RDJ University with 3 years of dental experience in Brazil, 2 years of research experience, a few months of volunteering experience, and shadowing experience in the US. She also is a recent new mother and has a passion for gardening. Now, to demonstrate how you should tackle each type of question during your interview, Flynn and I will role play a mock interview using Sarah. And we'll show you an average response versus what we call a striking response for each type of question. Are you ready?
Hi, it's my pleasure to be here today. I look forward to a conversation and getting to know you.
Hi, Sarah. It's nice to meet you.
Of course.
Thank you, Sarah. Let's get right into it. I'd love to hear more about you. So can you tell me a little bit more about yourself?
Yes. So I'm Sarah, and I come from Brazil. That's where I went to dental school as well. Right after undergrad, I started practicing in my hometown. That was quite an expansive experience for me. I got to collaborate with lots of people and treat lots of communities. Alongside that, I also engaged in almost 5 years of research on oral cavity cancer. And apart from these intense clinical and scholarly engagements, I also spend my time volunteering at rural areas in my district to cater to the oral needs of the underserved. That's a little about my career. And around 2 years back, I got the opportunity to shift to the US and dream bigger. I found clinics with dental assistant vacancies and try to absorb as much knowledge as I can, and understand what happens in the US. And it was very challenging because since my partner and I had our plates full with work and home and a 1-year-old toddler, but we managed to get through.
All right, so what do we think of this first response? First, let's go over some common mistakes. 1, no hook. 2, basically, Sarah is just repeating her CV. And the worst and most common mistake that happens is that she was repeating her CV without even adding any experience or learnings that she obtained throughout her journey. Another common mistake, and that we've seen, is that there was no smile, there was no empathy. Again, also her response doesn't really align with the school, it's a little too generic. And finally, the response that was just given doesn't really shows that Sarah doesn't really have control over the interview. So instead, what's a better response?
Yes, of course. Thank you. I think I can answer this in two timelines. The first would be my time back home. After graduating, I jumped right into practicing. And there's a reason for that. Throughout my undergraduate outreach and internships, I observed how it was very normal for dental clinics back home to not have a strong work ethic. As you might already know, preventive measures, awareness, and protocols are not really the same around the globe as much as it is in the US. So that learning really got to me. Personally, being truthful and professional is very important to me. As a dentist, I believe it's my duty. So, diving into years of practice was my way of trying to bring an actual difference, and I did. I spread education, awareness, and brought about changes in my workplace and passed on the importance of integrity to my juniors. So, those were very rewarding years for me. After years of perfecting my clinical prowess, I shifted to the US. And talking about the second half of my timeline now, which was in the US, it was more of an eye opener for me. In the new country, I started a new family with my spouse, and spending the last 2 years with my little one, it has awakened a lot of my beliefs. My thirst to make a difference spiked even more. I guess I see the world through her eyes as well now as a parent, and I'm always reminding myself how empathy is more important. And as an immigrant parent, I'm always looking for inclusive communities, which I thankfully also found when I assisted at clinics here in the US. And to contribute to building a better world is very important to me, and I know that's my purpose now. And her arrival has strengthened that drive in me. And the most attractive feature for me about joining your school as well is that because I resonate with your values and with your vision. An institute where multiple values like professionalism, respect, integrity, diversity, etc. drives education, I couldn't be happier. And it would be a matter of pride for me to be a part of this value system and to be a part of a school's legacy that believes in all of this. And together, I want to build a better world. That's what I'm looking for.
So why is this a better response? First, there was a hook that makes the interviewer want to listen. Two, the story that Sarah gave us is a story that mirrors who Sarah is and who she wants to convey to the interviewer and to the school. Another thing that was good and positive and that makes this response better is that the story that Sarah gave us is aligned with what the school believes in. And finally, with Sarah's new response, Sarah knows exactly the question that are likely to follow based on her response, and she's ready for them. She has a lot more control of her interview and is able to steer the interview, which is what makes an interview successful. So to sum it up, when asked, tell me about yourself, it's all about one, your story. So it needs to be unique and memorable. And two, it's what sets the tone for the rest of your interview, meaning it's your one chance to take control of your interview. And three, it should be tailored to the school.
I'll be the interviewer this time around. Okay. So let's move on with a profile-based clinical question that can be expected based out of Sarah's response to the first question. So that's very interesting, Sarah. Actually, I'm interested to hear more about your clinical experience so far. What are the different procedures that you have performed so far in general dentistry?
I have had a lot of clinical experience. I have performed many general dentistry procedures, including cleanings, restorations, root canals, extractions, and a lot more.
Now, what do we think of this response? Common mistakes were the answer sounds vague right at the beginning when Sarah says a lot of clinical experience. She's not talking about any numbers. So through her answer, the interviewer virtually learns nothing at all, right? And Sarah was not expecting this question, so therefore does not sound too confident at all while answering it. And she's not smiling, she's not connecting with the interviewer. She spoke very little of her experience altogether. Now, how can we frame a better response instead of this?
I have had clinical experience in India and in the US. Working in 2 countries has really helped me compare and contrast dentistry and make an informed decision. While working for 3 years in India as a general dentist, I performed more than 100 cleaning, over 80 restorations, over 70 root canals, and over 150 extractions. I was really able to improve my clinical skills while working in India, especially in the rural outskirts of my city. Now, when I shadowed in the US, I was also able to appreciate the relationship building aspect between the patient and the dental team. I realized how it was really important to gain the trust of the patients before starting any dental treatment. I also really appreciated how the dental team worked at the dental office in the US. I have been able to learn the good aspects of dentistry from my experiences and will bring it with me when I enroll in your program.
Now, why is this a better response? Sarah is able to give a very clear picture of her clinical experience. She's talking in terms of numbers. She compares and contrasts her experience between 2 countries and also brings in the cultural aspect, which adds a lot of value to her answer, right? Because shows the diversity in your career and shows what have you learned from those experiences. She seems more confident and has a smile on her face. So this is why this makes it a better response. Now let's move on to the next one, where Kenza will ask Sarah the next question.
You seem to be a diligent dentist who values thoroughness and integrity. We really appreciate these characteristics in our students. Can you tell me a little bit about what you consider to be your greatest weakness?
My weakness would be that I'm a perfectionist. It's essential to me that work gets done perfectly, down to every detail and on time. It bothers me if tasks are assigned or led by me are clumsily rendered.
What do we think of this? So let's go over some common mistakes. 1, keeping the answer extremely brief. 2, Sarah wasn't really explaining why it's a weakness. 3, Sarah is giving an impression that she isn't really comfortable speaking about her weakness. Another common mistake, it's a generic response. It's not very unique to Sarah. It's something that's been heard of quite often. Another mistake, she prepared for another answer. And finally, there was no example that was given, and so nothing tangible. Can't really tell what her learnings are. So instead, what's a better answer?
My greatest weakness has got to be this. I'm a perfectionist. There's a fine line between being detail-oriented and thorough and being obsessed by it so much that it restricts you from thinking clearly, delegating, or even keeping your cool. Unfortunately, for a long time, I couldn't see that line clearly. I think the naive professional in me, when I joined work right after school, contributed to that as well. In the race to set everything right and set things in place, I seldom took a minute to pause and think or calm down and let the small things be. My juniors at the clinic often took the hit because I would be extremely hard on them sometimes, often lose my temper. And since I had a mentor-mentee relationship with them, they helped me understand when I was not being fussy around them. They took that chance to understand that this wasn't the best way to do things over time. And I'm glad those experiences taught me this lesson. Ever since, I've been consciously putting in efforts to focus on the bigger picture and not let the devil in the details be the devil in my demeanor, you know. And like, for example, if there's a pressure inducing situation going on and we're having a conversation or a meeting, I would step out for a minute or two. I would take a few deep breaths and I would just remind myself, what is the purpose of this meeting? What is the purpose of our discussion? And then step back in and speak and further, contemplate and discuss with a clearer mind. It sounds like a small step, but it really helped me a lot through this transition, through this development of mine, personal development of mine. It's obviously a process, and I'm still evolving, but I'm getting there, and I'm really glad.
So why is this a better answer? 1, very specific. 2, not brief. 3, she mapped an example to the clinical practice period. 4, she was comfortable, and you can tell that she was comfortable being vulnerable. And finally, this response also made it clear that Sarah does want to improve and that a weakness is actually an area of improvement for her.
And we're done. So we sure hope this gave you a well-rounded understanding about how to tackle interview questions. We'll just try to sum it up for you, right? What are the key points here? Make your responses your own. We cannot, say this enough. I think you would have noticed in most of our videos, we talk about this. Make your responses your own. The interviewer has listened to another 50 responses. So you should bring in your own stories, your flavor, your persona, and keep them hooked. Next, the second one, try to align your answers to the school, their beliefs, specialties, values, programs, wherever applicable. Try to give them an understanding that you know what you're getting into and you know about them, and and even after knowing that, you want to be a part of that program. Number three, take control of your interviews. Steer the conversation, especially for closed file interviews, like I mentioned before. Closed file interviews, you have more power to steer the conversation, to give them what you want them to hear. And number four, just realize that they're not ready with profile-based questions already, unlike how they might be in an open interview. So they will curate their questions based on your responses. So you have the power to lead the way and show them, what you have, and definitely do that. Tell them what you want them to hear, and ace the interview.
The interview is your arena, the last milestone in your application process. We believe that you have got this, but you need to believe in that as well. Take control of your interview. Take control of your narrative. Be confident and run with the wind. We are right behind you. And don't forget, if you need any help, reach out to us and we'll answer all of your questions. Good luck.